Today we are going to discuss regarding obviously your laparoscope and the minimally invasive surgery is there. Also, there are a few newer modification of the minimally invasive surgery is also there nowadays. Like there is a single port access natural orifice transluminal endoscopic surgery, which is also known as the NOTES. There is stills, and obviously there is a robot assisted surgery, which typically uses the Da Vinci robot system. Also, there is a minimally invasive hemorrhoid treatment is as well. So here the purpose of this today's topic is to just get the overview regarding these things. Okay, so let us first of all get familiarized with the recent advances or the recent technologies that has been available for the minimally invasive and the few basic aspect of the minimally invasive technique as well. Okay, so here is your laparoscopy and the minimally invasive surgery. So your fast, as we all know, like the laparoscopic cholecystectomy is the basic surgery in case of minimally invasive surgery, and it has been first done in the United States around 1988. So nowadays, it's almost around all the organs inside the abdomen or even outside the abdomen as well. So they are basically accessible by minimally invasive technique, right? And nowadays, your laparoscopic cholecystectomy becomes a standard of care in case of dealing with a patient with a cholecystitis, right? Or any pathology that has been related to the gallbladder. So obviously the area has been changed, and obviously the guidelines has been also changed, and nowadays it also now we are also looking for the opportunities to explore the robotic surgery in case of cholecystectomy as well. And obviously nowadays, most of the high volume centers they are basically doing the robotic cholecystectomy as well. Okay, so apart from laparoscopic cholecystectomy, you have your laparoscopic appendicectomy and the laparoscopic hernia surgery. So these three operations are basically hugely done in any high volume centers in nowadays. But obviously, to proceed for more than that, like even to proceed for like a laparoscopic tap repair or tape repair, which is basically done for the inguinal hernia surgery, they basically need specialized training to deal with the tissue. Now, let us get the introduction or few overview regarding the laparoscopic instruments, right? So your laparoscopic instrument, you can see in this image, there are multiple instruments has been there. So I'm just, as I have said, I'm just here to give you the just overview. I'm going to discuss in detail in each of the subsequent segment uh, later part of our course, right? So first of all, there is a grasper. Okay, so the grasper, as we know in the surgery, that the traction and the counter traction is basically what that opens the plane or the surgical plane for us, right? So obviously, to provide the counter traction or the traction in this of laparoscopic instrument, so there that's why there is a grasper is there. So obviously, this grasper is basically divided into like blunt and there is a tooth and non-tooth grasper, right? So tooth grasper, obviously, you guys have been like pretty much familiarized with a laparoscopic cholecystectomy, while like the fundus of the gallbladder has been taken care by the tooth grasper, and in case of the non-tooth grasper, they are basically uh, uh, used to give the traction in the Hartmann's pouch, right? It is as simple as that. Uh, then comes your shears and the cautery. So look, obviously, like in case of open surgery, we do need to use the energy sources. So obviously, in the energy sources, there is your unipolar cautery, then comes your monopolar. Sorry, monopolar cautery or the unipolar one, and also there is your bipolar one as well. So the thing is that you need to be cautious regarding while using the monopolar cautery because the lateral spray of the instrument is much more, and they are basically available as a laparoscopic hook or laparoscopic spatula. Okay, also you can apply that using with a laparoscopic Caesar as well as laparoscopic Maryland forceps as well. Then comes your bipolar. Obviously, bipolar is a very much favorable instrument as well as in case of open surgery as well as for the laparoscopic surgery. But you have to understand that obviously there is a use of the harmonic scalpel, which is basically based on the ultrasound principle, and obviously by this ultrasound principle, they basically cut through the tissue, and also there is a ligature the staplers and the suturing devices are also there. And in the suturing devices, you are supposed to get a tacker, which could be made up of both the absorbable and the non-absorbable material, right? And they are basically used to fix the mesh with the anterior abdominal wall. Okay, I mean, in case of IPOM surgery or in case of laparoscopic tap repair, okay. But obviously, there are staplers, which is known as the endo-GI staplers, right? Endo-GI staplers, they are basically used for the resection and the anastomosis purpose. Resection and the anastomosis purpose. Okay. So, apart from the generalized overview regarding the generalized overview regarding the instrumentation, you have to understand obviously why nowadays the patients are basically running for the laparoscope surgery. Even the surgeons are. Why? So first of all, as a patient perspective, obviously the patient prefer this because of the cosmesis, right? It basically associated with a less scars, and obviously your access area is basically like you just try to access the abdomen through very small, like around 10 millimeter and the 5 millimeter, 3 to 4 scars has been done, and that too, among that, one should be done at the umbilicus level, right? So obviously, mm, like while doing an around 5 to 6 centimeter long subcostal right costal incision, obviously the patient will going to prefer laparoscopic procedure. And another thing is that as you just your incision length becomes smaller, so obviously it will be associated with a less pain to the patient. So obviously, this is another important point, and obviously shorter hospital stay, because as your pain and the associated morbidity as well as the wound infection or wound morbidity becomes less. So that's why they are basically associated with a shorter hospital stay. And this shorter hospital stay obviously helps the patient to deal with a um, uh, to deal betterly with a nosocomial infection as well as economic perspective is there as well. So although fewer adhesion or the scar tissue has been there, look what happened. Once you open an abdomen, obviously through the incision line, so there is a development of the scars. Okay, so that scar is basically seen from the outside, but there has been some changes that happens in the intra-abdominally as well. So that changes in the intra-abdominal is basically your adhesion for you. So there is a adhesion of the surrounding momentum and the gut, and they basically getting adhered to the that uh, um, incision line, and that basically makes us the problem while doing a second operation in any case. Now, the advantage with the laparoscopic surgery, is, as you can see, like the length of the incision becomes smaller and smaller nowadays. So, your length of the adhesion or amount of the adhesion that has been associated with it, that will be again less. So, that's why the advantage also wound infection, because your wound length is less. So obviously, your chances of the patient getting wound infection is also going to be less. Also, there is a fewer post-operative complication that has been associated with the laparoscopic surgery. Suppose a patient comes to you with a you just perform a simple open cholecystectomy with a subcostal incision or the costal incision. In that case, obviously, you have to take care about as it is basically subcostal incision. So obviously, there is a chances of lung atelectasis or secondary lung infection. But in that case, laparoscopic surgery, that chances is very less, and as well as the patient is able to mobile just from the next post-operative days, or even in some cases with a good operative hand. Obviously, the patient can mm, be mobile after 6 to 10 hours as well. So that's the point. And also, the benefit of the laparoscopy surgery, you can take the photographs, video, as well as magnified view for the medical legal purposes as well as for the educational purposes as well. Right?